This is Joe Bouchard. Welcome back to the afternoon session. This is going to be the STAR session. And hi, my name is Joe Bouchard. I'm the chairman of the board for the CMTA. It's my great pleasure to introduce the STAR program for this afternoon. We have 3 hours, and you'll see we have a really exciting agenda for you. Just a couple personal words. I know we all have our own CMT journey. Ours for our family started about 20 years ago when our son Johan was diagnosed with CMT, CMT1A, and it was the first in the family, so it was a big shock, and the CMTA was really helpful in helping us navigate through this, and we've been involved with the organization ever since, trying to help progress our cause here, and it's been a great journey. So Johan's been our inspiration. You might remember last year, I couldn't help being a proud dad and showing this picture. This was actually one of Johan's first bike ride in 25 years. He got an e-bike and we started biking together. And this one was our really fun moments. So of course I have to give you an update because you can see there he's still a little wobbly. Well, he's been mountain biking now. So here's Johan a year later, doing his mountain biking, going down the hills and mountains. So the point I want to make is, you know, the CMT journey is not easy. It's tough, it's a rough road, but there are some moments of joy like this one, and we'll all have those. It's important to share them. And there are moments of hope. And I think the STAR presentation you're going to see, it will be a moment of hope. It's been for us, it's been for me. It provides a lot of hope. So let's get right into it. So here's the agenda. So again, it's both very exciting that there's so much to present and the STAR program has grown so much, but it also is challenging to give you a good overview in 3 hours. So as you can see, this has evolved a lot over the years, and now we are using this wonderful platform to go into different subsessions. So here's how we've organized the day. And we really try to strike a balance between giving you a broad overview and covering a lot of ground, but without going into too much details and spending too much time, because we could spend hours and hours and days on this. So the first session with John, Mike, Steve, Stefan, and June, they will give you an overview of the various families of diseases and also an overview of the approach, the strategies, and the plan that have been developed. Okay. And then in the second session, so there'll be 5 of those. And then we go back to 3 sessions where there we'll be focused a lot more on therapies. What are we doing? What's going on? And again, there we'll not be able to cover everything, but I think you'll get a good view in details of some key projects and key initiatives that we're all excited about across the 3 major types of CMTs. And then afterwards, for the first time, something very exciting, we're going to have some of our biotech partners join us for a roundtable. So Tom Dubansky, who is a board member of the CMT, also the CEO of biotech himself, will be joined by 4 panelists from 4 companies who have been basically working with us and kind of going through different Q&As and explaining their views of CMT. And again, we try to strike a balance here. We have a lot more partners, but what's interesting, you'll see those 4 partners covers all 4 kinds of CMTs, 1, 2, 4, and the undiagnosed type. They also, you have 2 gene therapy companies, you have 2 small molecules companies. So I think I'll give you a good feel of the kind of companies that work with us. And then we'll do a little wrap up. So that's the agenda. And then before we get into that, let me just say a few words about STAR. As you know, STAR was started about 12 years ago when we got together as a board and realized that, frankly, the picture for CMT therapies was not very bright. CMT was still in what I would call the age of discovery. A lot of great researchers learning more about how CMT worked, discovering genes, but there was really nothing in terms of bringing drugs to market. There was no involvement for pharmaceutical companies. And so what we did, being business people, we took a very basic business approach. And when you try to solve a problem in business, basically you look at the strength, you look at your weaknesses, and you figure out a strategy that can take advantage of your strength to alleviate your weaknesses. So what we found then is still very relevant today. So I'm going to go over it very quickly because it will permeate everything you're going to see today. So the challenges. The first one is common to all drug developments, is that it takes a lot of time, decades to develop new drugs. takes a lot of money, usually more than $1 billion, and is very risky. Remember, about 90% of the drugs that enter clinical trials fail. So it's a really high risk business. Now, more specifically for CMT, what's probably the major impediment right now to draw attention from pharmaceutical companies is that there hasn't been a single successful trial. That is not, there is not a single FDA approved drug for CMT, so it's a huge risk factor, and the drug approval and the clinical process are basically untested at this point. And the third one, also very specific to CMT, it's perceived to be a slow and progressive disease, which means to conduct a clinical trial, you would have to use a lot of patients over a long period of time to see some results, which means, again, long and expensive clinical trials. Now, on the plus side, there's a lot of things going for us in CMT. The most important one, and you'll see a lot of that today, is the fact that we know the genetic causes so well. I would say CMT, people always tell me, has very clean genetics. It's called a monogenic disease. It's a very simple cause and effect relationship between what's happening at the gene level and the disease, which is, by the way, is very rare in medicine, especially in nervous system diseases. Which means, as we often say, if we can reproduce a problem, it's halfway solved. So we could create all kinds of test vehicles, what's called assays, stem cells, animal models, to model the disease so we can really test it. And the other one is we're seeing right now an explosion in the genetic space, in genetic therapies. You've heard of CRISPR, gene therapies, ASOs, RNA interference, and luckily all these apply to CMT. So our role was to make sure all those technologies are now being applied into CMT treatments. The second part regarding the length of clinical trials is we can use what's called biomarkers. And you'll hear a lot about those today. And it's probably the most important thing we have to do now. It's one of the last missing links in CMT, is to find biomarkers that give us an early read on how a therapy and a medication is working, and doing it in a way that's correlated to how it impacts the patient. And this work is going on, you'll hear about it. And we've invested a lot of time on that, a lot of money on that. And it's one of the best hopes we have to make faster and lower cost clinical trials. And then from a business point of view, CMT is an interesting disease because it's classified as rare, which means it benefits from all the advantages that are granted to rare diseases in the US and Europe. Yet it's a big market. I mean, there's a lot of us. There's 150,000 people in the US alone with CMT, so it's a big market. So it is attractive business-wise, which really matters as well. So this is the basic analysis we came up with, and frankly, it's still guiding everything we do today. It's still very true. So as you understand by now, the core of STAR is to make CMT attractive to partners. So we found there's essentially 5 things that do that. And not all companies use all 5. In fact, at a given time, the company will probably use 2 or 3 of those, and it might evolve over time. So the first thing, they want to know more about CMT. You know, they tend to be expert in their own technology, but they don't know CMT very well. So we've assembled a large group of experts, what we call KOLs, key opinion leaders, to help guide company understand CMT better. Now, once they understand CMT better, they want to test. And there, in the last 10 years, STAR has made a huge effort to develop what I think is a world-class testing infrastructure with all kinds of models, with experts, so that people can come in and test the drugs very fast, very inexpensively, with the best models and with the best experts. And then what we're seeing now is that not only companies, they want to test their drugs, but companies who've found that CMT is attractive from a business point of view and say, wait a minute, maybe we want to license some of the work you're doing. So you'll see that today a lot. A lot of companies come to us and actually want to take the work that some of the scientists have started and take it to market. Okay, and then we talked about clinical trial readiness, biomarkers, and so there's a huge amount of work going on in there, and still a lot needs to happen. And last but not least, very importantly, we all play a role here. Companies always want to know more about the community. They want to know how CMT affects us, essentially because we're their market. So they need to know who we are, what CMT does to us. And so we've developed a lot of ways that we can do this. And the fact that the CMT has this amazing reach into the community is becoming a great asset for our pharmaceutical partners. So is CMT-STAR working? Well, rather than take my word, I'll just go quickly through a couple of numbers. We have 30 expert advisors. We spent over $17.5 million in research. On the pre-clinical testing side, we have a whole panel of testing, and we this year we're starting 21 preclinical studies with partners. Now, 3 years ago, this was just started. There was maybe 1 or 2. So this is becoming a huge asset for us. It's really exciting, and also exciting that we have 50 projects, 5 new projects approved, up to 40 alliance partners in STAR. Okay, remember 10 years ago, 0. 5 years ago, maybe 5 or 6. We're up to 40 right now, and you're going to see a few examples of that today. And then from a community point of view, Center of Excellence, branches, massive reach through social media, etc. So I think the team went through this a bit more in detail this morning, but the community reach is really working well for us, so we all play a part there. The other way to see if something works in this world is what's called a pipeline. How many drugs and projects do you have flying information going through the life cycle? And our pipeline has become so big now that we need 2 pages. So there's 1 page for the type 1s and 1 page for the other types. Last year we had 1 page. 5 years ago, it was basically half a page. So this is incredibly positive. If there's one picture that gives me hope for the future, is this one. And here's why. Because why is it so important to have such a broad pipeline? 3 reasons. Number 1, remember the risk, the 90%. So we cannot rely on 1 or 2 projects. If someone comes to you and say, I got this great project, put your eggs in my basket, don't believe it. You need lots and lots of projects, because this is what the industry calls the valley of death. Well, if you're going to cross the valley of death and you're going to lose 90% of your people there, well, you better have a lot of projects to go through. And we're starting to be at a point that we have enough projects, enough technologies that the risk is really minimized. And the second one, there's a lot of cross-benefit here. Because remember, I said one of the main issues and challenges that no CMT drug has ever been approved. Well, the minute one of those goes through, it doesn't matter in which type of CMT, it will open the floodgates for people to work on the other. So even me, as a father of a 1A kid, nothing is more exciting when I see progress in other types, because I know if they happen to go over the line first, it will have tremendous impact on everybody else, including my son. Okay? And then so I will leave you at that, because we have a lot more to cover. Again, a lot of hope there, and I will turn it over to the docs. Again, this gives you the big picture, and you're going to see more in details. Again, back to the business analogy. In business, you need to have a great strategy, which we have. So it shows that it's working, but you have to execute. So now let's listen to doctors and see how well we execute. I'm going to leave it there and turn it over to the doctors. Thank you.